Welcome to the deep dive. We sift through the details to bring you the key insights. Fast. Today we're tackling a pretty serious condition in cattle, bovine Vena Caval Thrombosis. You might also hear it called metastatic pneumonia, maybe pulmonary thromboembolism. Yeah, it's a tough topic, definitely grim, but also, well, medically fascinating. It's severe, often fatal in cattle, and it really shows this dramatic, deadly endpoint of whole chain of events. It's not super common, maybe rare even, but it really highlights why managing those, underlying health issues is so critical. For this, we got two detailed sources that kind of map out this medical puzzle. So our mission today, let's untangle this surprising cascade, this chain reaction that leads to such a devastating disease. Okay, let's unpack this. How does this catastrophic chain reaction actually kick off? The sources point to it being a classic cascade. And it almost always starts with one thing, ruminal acidosis, right? That's a metabolic disorder, pretty common in feedlot cattle, high-producing dairy cows too, especially if they're on high-grain diets. That acidic environment literally damages the lining of the rumen. Rumenitis, they call it.
Yeah. Exactly. And what's really interesting here, I think, is how something starting with diet, metabolic issue, opens the floodgates for infection somewhere totally different. So once that rumen lining is damaged, the rumenitis, it lets certain bacteria get out. We're talking primarily Fusobacterium microforum and Truparella pyogenes. They escape into the bloodstream. Then they travel through the portal vein, which goes right to the liver, and boom, liver abscesses.
Wow. Okay. So a diet problem damages the gut lining, bacteria escape, travel to the liver, and set up shop as abscesses. That's quite a sequence already. Do these abscesses just sort of sit there harmlessly sometimes? Or is the danger immediate?
That's a good question. Some might stay contained, perhaps.
Yeah.
But the real escalation happens because of where the liver sits. It's right next to the caudal vena cava. That's the body's largest vein, running super close. Now, if one of these liver abscesses is near that vein, it can actually erode right through the vein wall. That triggers a massive inflammation. It leads to this septic thrombus, basically a huge infected clot inside the vein. Blood, bacteria, inflammatory cells, the works.
A septic thrombus inside the body's biggest vein. Okay, that sounds incredibly dangerous.
It absolutely is. And connecting this to the bigger picture, well, the lungs are next in the firing line. See, pieces of this septic clot, we call them emboli, they can break off. They get swept into the bloodstream, go through the heart, and then they inevitably get lodged in the tiny blood vessels of the lungs. It's like this showering of the lungs with infected material, septic emboli everywhere. That causes widespread lung abscesses. And that's what we mean by metastatic or embolic pneumonia.
A showering of the lungs. So we've got these infected clots lodging everywhere in the lungs. What's the final act? Does it just keep getting worse, or is there a specific fatal event?
There usually is. It's the climax, really. The infection and all that inflammation in the lungs, pulmonary arteries, it weakens the artery walls. They can form aneurysms, like little balloons, weak spots on the vessel wall. The final event, often incredibly sudden, is when one of those aneurysms just ruptures. That causes massive bleeding, a huge hemorrhage right into the airways.
Catastrophic bleeding into the lungs.
Exactly. And it's worth adding something important sources mentioned. While that ruminal acidosis path is, well, very common, this Vena Caval Thrombosis, VCT, it can also happen following severe bacterial pneumonia itself, involving the usual suspects like Mannheimia hemolytica, Pasteurella, Histophilus somni, sometimes Mycoplasma bovis. In those cases, it seems the bacteria might spread more directly to the vena cava, though interestingly, having liver abscesses or acidosis might still make the animal more likely to develop VCT even in that pneumonia scenario. So it shows there could be multiple pathways or maybe contributing factors stacking up. You really need to look at it from different angles.
That is fascinating. Multiple routes to the same terrible outcome. So given how this all plays out, what would you actually see in an animal? What are the signs?
Well, the clinical picture can vary quite a bit, but when it hits hard, the signs of severe respiratory and circulatory problems are often pretty dramatic. You'd expect to see respiratory distress, labored breathing, rapid breathing dyspnea, and tachypnea. But the real telltale sign, the hallmark, is hemoptysis. That's coughing up blood, frothy, bright red blood. It screams ruptured pulmonary aneurysm. Wow, coughing up frothy red blood. I mean, that's got to be terrifying for anyone seeing it. And you mentioned nosebleeds, too.
Yes, epistaxis. Bilateral nosebleeds from both nostrils are also seen pretty frequently. Alongside those really acute dramatic signs, you might see more general things building up too. Things like chronic weight loss, maybe pale gums and membranes from anemia, an on and off fever, not eating well, just looking depressed, maybe milk production drops off in dairy cows.
And then, sometimes, nothing. Sadly, yes. Sometimes the first sign is finding the animal dead. With clear evidence of a massive hemorrhage having occurred, they might have shown very few signs beforehand.
Which brings us to diagnosis. How on earth do you confirm this in a living animal? It sounds tough.
It is tough. Antemortem diagnosis, so diagnosis before death, is really challenging to be absolutely certain. It's often what we call presumptive. Based on those classic signs, like the hemoptysis, especially if it's, a feedlot steer or a dairy cow where the risk factors align. Ultrasound, thoracic ultrasonography can help sometimes. You look at the vena cava. Normally it looks kind of triangular in cross-section. With a thrombus, it might look dilated, more circular. You might also use x-rays, radiography, to look for lung abscesses, or even echocardiography, an ultrasound of the heart, to see if you can spot thrombi in the vena cava, or if the heart's involved. But really, the definitive diagnosis, that almost always comes after death, at necropsy. The key findings there are pretty clear. The liver abscesses, the thrombus jammed in the caudal vena cava, and then multiple abscesses all through the lungs, often with obvious signs of hemorrhage or those burst aneurysms.
So given everything we've heard, the prognosis sounds absolutely dire. We've talked about treatment, but is there any scenario where an animal can pull through? Or is prevention really the only game in town?
The prognosis is exceptionally poor, let's be blunt. It's considered fatal in almost all cases once those signs appear. We'd classify it as guarded to poor at best. And sudden death is, unfortunately, common.
Okay. And treatment?
Generally unrewarding. You could try really aggressive long-term antibiotics, things like florfenicol, oxytetracycline, but honestly, it's rarely successful once you've got a big septic thrombus and the lungs are riddled with abscesses. Supportive care. Sure, you can give NSAIDs like Flunix and Meglamin for inflammation and pain, maybe fluids, nutritional support, but it offers very limited benefit, realistically.
So because the prognosis is so bleak, and for animal welfare.
Exactly. Humane euthanasia, or sometimes emergency slaughter if appropriate, is often the most responsible course.
Which puts all the focus back on stopping it before it starts.
Absolutely. Since treatment is so challenging, prevention becomes absolutely critical. All the effort has to go into stopping that cascade early on, and that means tackling the main starting points. Two main strategies here. First, controlling ruminal acidosis and those liver abscesses. That comes down to smart nutritional management, especially adapting cattle carefully to high-grain feeds. Gradual changes are key. Making sure they get enough roughage, too, keeps the rumen stable.
Any other tools for that?
Yeah, there are various feed additives, in-feed antimicrobials that can help reduce the incidence of liver abscesses. The second big strategy is managing pneumonia, respiratory disease. That means catching pneumonia early and treating it aggressively. Stop it before it potentially progresses to, bacteria in the blood or the thrombosis.
And basic hygiene.
Oh, definitely. Good biosecurity, managing the environment well, minimizing stress, all crucial for reducing exposure to those respiratory bugs in the first place.
It really is a stark reminder, isn't it? How interconnected things are, metabolic health, infectious disease, it all links up in cattle. So we've traced this journey from what seems like a simple dietary issue maybe, or a lung infection, through this really complex cascade. Bacteria invading, clots forming, organs getting damaged systemically, all leading to a fatal breakdown. It's a devastating sequence, bovine Vena Caval Thrombosis, but medically it's quite a case study in biological domino effects.
It really underscores how complex these biological systems are and how things you might think are separate issues can be intimately linked. Understanding those hidden connections is just vital, especially like you said, when direct treatment is so often futile. Prevention is everything.
Absolutely. That interconnectedness, that feels like the core message here. And it makes you think, doesn't it? Consider how often seemingly isolated problems, maybe in any complex system, biological, sure, but maybe even mechanical or social, might actually be part of a larger hidden chain reaction. What other deadly legacies might be hiding in plain sight, just waiting for us to connect the dots? Something to ponder. Thanks for joining us on this deep dive.